Hello, and thank you for tuning in to Answers from the Lab, where we share Mayo Clinic knowledge and advancements on the state of testing and science from laboratory leaders and the people who are making it happen behind the scenes. I'm Dr. Bobbi Pritt, Interim Chair of the Department of Laboratory Medicine and Pathology at Mayo Clinic in Rochester, Minnesota. With me today is Dr. Eric Hsi, Chair of the Department of Laboratory Medicine and Pathology at Mayo Clinic. Dr. Hsi assumed the department chair role in January, so I've had the pleasure of working with him for several months. We're excited to introduce him to our listeners today and get to know him and his thoughts on laboratory medicine and pathology. Dr. Hsi, thank you so much for joining us today.
Oh, good morning. Pleasure to be here.
So can you share a little bit about your background and what drew you to pathology?
Oh, yeah, sure. I am not a stranger to the Midwest. I kind of grew up in Michigan, Kalamazoo, for those if it's like right there. So I did all my training at in Michigan at the University of Michigan. Both my kids have gone there, so there you go. Then I, spent time as a hematopathologist, mostly at Cleveland Clinic, and then more recently at Wake Forest. I really enjoyed the diagnostic work and kind of specialized in heme malignancies. My dad was a laboratory person. He was a chemist, and I kind of got that bug about working in a lab. And as I went through medical school, I kind of realized that there was actually a path for somebody that really liked laboratory science in pathology and lab medicine. And so I kind of gravitated towards that and sort of found my niche. Ever since, it's been a great ride. I think what we do is a real privilege. And I've been so fortunate to sort of be at some great places, and now including Mayo Clinic. And I'm really looking forward to working with everybody here.
Well, thanks, Dr. Hsi. Yeah, we are in a great specialty, aren't we? And we're so excited to have you here. So as you begin this new chapter at Mayo, what are you looking forward to working on?
Yeah, I really want to kind of see what we can do in taking advantage of some investments already been made, actually, in DLMP, which is bringing machine learning and AI tools into daily practice here at Mayo Clinic, and really beginning to unlock kind of the hidden information that's in big laboratory and clinical data sets, so that we'll be able to enable better clinical decision making, improve patient diagnosis outcomes, maybe even aspirationally to prevent serious and complex disease. So if we can find laboratory correlates that would give early warning and actually allow intervention to prevent disease, I mean, that's probably the best thing that we can do instead of treating advanced disease already. And so if we can kind of get into that space and make contributions, that would be a real contribution for DLMP to the field.
Sure, absolutely.
I think expanding it, in that same vein, is really expanding our innovation and research portfolio. I think in ways really that dovetail with the strengths of the clinical practice at Mayo Clinic, and that really leverages our expertise and knowledge of structure and cellular relationships. So one thing I'm thinking about working with the new research chair, Peter Lucas, is we're very interested in exploring how we can make advances in spatial biology and spatial profiling that would really play to our strengths and sort of serve the practice at the same time.
I think that's fabulous.
I think positioning, DLMP for new models of working with Mayo Collaborative Services, right? Because I guess the recent split between DLMP and MCS, but really, how do we position DLMP to be, the preferred provider for MCS and for real serious and complex diagnosis, while keeping the focus on the patient at the same time? That's going to be an interesting needle to thread that's going to require a lot of original thought and input from all of you to sort of figure out how we navigate that. But I think one thing I realized, both actually in my practice at other places, but certainly now getting introduced to in the environment here, is everybody in pathology lab medicine in the field wants to work with Mayo and trusts Mayo Clinic and Mayo clinical labs to provide, answers when you have a real problem. And I think, it's well deserved. And we want to try and kind of keep that and build on it.
Yeah, that's great, Dr. C. That I think Mayo Clinic's focus on patient care and innovation are two things that just, really drive us forward and also gives us a lot of opportunities working with others. So your discussion about some of the challenges, that brings me to my next question. In your opinion, what are some of the most common challenges that laboratory professionals face today? And what are some thoughts of how we would overcome them?
What struck me over sort of my career is now seeing how fast advancements in the practice of medicine and therefore in pathology occur, and the pace of change in the scientific advancements really require us all to be current and ready for how our jobs and tasks are going to change, sometimes faster than we would like. And I think, the real key to that is just having a quality of being curious, asking questions, staying abreast of the literature. I mean, who would have thought, I don't know, maybe, even 5 or 10 years ago that we'd have a big, part of our laboratory staff developing and maintaining next generation sequencing pipelines, curating variants, working on custom automation lines, or involved in cellular and gene therapies. I mean, these are things that, have happened really in a big way in the last 10 years. And we were, who would have thought that we'd be doing this kind of thing on a routine basis, even 10 years ago. So, our jobs will change. The information that we need to know changes. So I think the one thing that we can all do at all levels, from no matter what you're doing in DLMP or in the clinical laboratories, no matter what your role, is to be curious and ask questions. And I think if we do that, we'll be able to be, more prepared and have an open mind to change, because, change is inevitable, as they say.
Yeah. Well, that really plays well into some of the programs we're really doing for managing a daily improvement, as well as your thought of be curious. We really need our lab staff to be curious, to innovate, to be the ones that are the boots on the ground, people doing the testing, bringing their ideas forward and talking about what is a problem for them in their day and how we could potentially overcome it. So
Yeah.
lots of great opportunities. Now, you've mentioned artificial intelligence, automation, next generation sequencing. So I'm guessing I already know the answer to part of this question, but I'll ask it anyway. What are the advancements or trends in pathology that really excite you the most? And then how do you stay current in those?
Yeah, I mean, you're exactly right. We've been talking about this, you and I, and then others, since I've gotten here, is the real use of AI tools and machine learning to develop, new ways of doing things, providing new information, um, thinking about these issues, and being a leader in this space. I think, what we have to do is kind of foster that and let people know that these tools are coming and that we need to be facile in them. And it's really just talking to our own experts, getting to meetings. I mean, realizing that we actually do have expertise here. I mean, I was just at the USCAP meeting in Baltimore last a couple weeks ago, and DLMP had over 20 presentations by consultants that was talking about AI and machine learning tools. So I mean, we are kind of already a leader in that space. People are already looking to us to see what we're doing. And so I think just continuing to be a leader in that space, looking at how we can help our practice, because I think if it's good for us, it'll be good for others, right? In medicine, I think that, and the other thing that I think is going to drive our technology, our practice, is the expansion of predictive and prognostic biomarkers and the new methods that we have to bring to detect them. And so, it's that still, to stay current, you need to be curious and kind of really curious about what's out there, and then doing whatever, is right for you. Is it going to meetings? Is it reading the literature, talking to your colleagues, and kind of thinking about ways that you can contribute.
I like that. Be curious, stay curious. Well, I'll end with a question just for you to reflect upon so you can share your wisdom with the group. What advice would you give a pathologist just starting their career and eager to contribute to advancing patient care and all of these exciting things you've just talked about?
Well, I think for those just starting out, it's really, you train at the best place possible that aligns with your interests. Understand, I think, that your job is providing accurate and actionable information, in a clinically relevant format to people who aren't experts in what you do. So to make your information digestible and relevant, I think, we sometimes forget that our value really comes from the interpretation of the data that we're generating. And so creating or staying in that information interpretation loop is really what matters. It's not so much having the latest piece of technology, or the I call them toys, right? It's not really exactly having the best toys, but it's what to do with the information that they generate. Yeah. Because at the end of the day, in some areas, you may not need to have that toy, but you need to know, the information that comes from it, be involved in that pipeline, so that you can, add value to your clinical practice. I think that's kind of a sort of slightly different spin on the way you think of what your job is in pathology and lab medicines. The other thing is, as I've learned, you've learned this too, I'm sure, is that you are a part and will likely lead teams, no matter where you are as a pathologist. I mean, in community practice, in an academic center, in a reference lab, I mean, you will be part and will likely lead teams given your role. And so, the more that you can learn to, support your team and empower them, the more effective I think you're going to be in that. I mean, no one ever told me that until, too late in my career. But I think that's true. And then the final thing is, I mean, congratulations, good on you, right? You made the right choice. As a young person, going into pathology. I think pathology and lab medicine, is medicine, right? You sort of have to know, a lot about a lot of different things. And so you can still pick and choose where you focus. And that's really quite a, as I started out when I said, I think it's quite a privilege to do what we do. So, don't forget to sit back and enjoy the ride.
I love that. That's great advice. Yeah, I think of pathology as really the foundation of medicine, given the amount of information we contribute to the medical record. Usually it's quoted as 70%, but just thinking about how people rely on us to make the diagnosis. We're part of the clinical care team. We're physicians caring for patients, even if we don't see them directly. And I really like what you said, Dr. Hsi, about the fact that we could have the fanciest new toy or whatever, but it's all about being part of that team and delivering the information in an understandable way to our colleagues who are seeing the patient and making these care decisions. If we're not communicating effectively, then it doesn't matter what fancy new toy we have. We have to really consider ourselves clinicians, part of this team caring for patients.
Yeah. I mean, I know that you and your group do that in spades. You guys came through the COVID experience and really showed the value of laboratory. So I think, you're spot on that we need to be good at it. You guys are good at it in your area. And I think, the more we foster that in our trainees, the better off the field will be.
Yeah, I agree completely. Well, thank you, Dr. Hsi, for sharing your time with us today. It's been really fun getting to hear a little bit about your background, and I'm sure we'll have you back with us at some point in the future.
Oh, thanks a lot. It's been a pleasure to be with you.
Thank you so much for tuning in to Answers from the Lab. Be sure to subscribe to this podcast, and don't forget to tune in every Thursday and every other Tuesday.